Thanks for watching Mid-Morning this Tuesday. A new study of hospital patients shows you may want to pick a female doctor.
Yeah, the study found that patients who were treated by women physicians were less likely to die within a month or have to come back to the hospital than those treated by men. It's fascinating. When you look at the difference here, it's pretty small, right? For those of us who look at percentages and you say, what?
It's a half percentage point.
A little less than 0.5%. Not much, right?
Yeah.
But when you multiply that times the number of people who go to the hospital, it makes a significant difference. A female doctor. The experts don't seem to know why, but they say if male doctors had the success rate that female doctors seem to have, about 32,000 people in the Medicare population would have their lives at least extended that month that they're doing this.
32,000 lives. That's significant. And if you were to think if the health community could come up with anything that would save a half percentage points of lives, they would administer that as a widespread treatment.
So the reasons are interesting, Matt.
Yeah, some of them make sense. I think women generally are better communicators than men.
Right.
And they're also, this I thought was interesting, they're also more inclined to follow clinical standards than men are. They're going by the book more than their male counterparts.
Now, part of the challenge with this research is that you're looking at a hospital population. So this is not the same as like going to your family doctor. This is the doctor you're getting at the hospital. And so when you think about it, if you are an elderly patient, which is largely what the Medicare population is, you're really being treated by a team, Kim. You may have one female lead physician, but you might have 2 or 3 physicians, right? I mean, depending on the time of the night.
How much is this just the one doctor?
Yeah.
You know, it's a team of people. But it is significant, though, if you look at the number of lives that are being saved.
It's got to be something, right? Why is there this correlation?
I wonder, though, could it be something that maybe are patients more willing to listen to the advice of a doctor if it comes from a woman? If a woman doctor says, okay, you should limit this from your diet, you should exercise more, are we more inclined to listen and take the advice?
Whatever women tell me, I listen to. I mean,
yeah,
that's a survival technique for sure.
Well, it is interesting. I think there's long been this stigma in medicine that men make better doctors.
Yes.
Decades long. And now you have a study that says, okay, that's not true, and in fact, women might be better doctors, but there's still a large wage gap.
There's a recent report that said there's about a $20,000 pay gap between male and female doctors, even after controlling for age and specialty and faculty rank. I mean, I know there have been some research where they say, well, women tend to be more family doctors instead of specialists. Doesn't matter, they control it out.
Yeah.
And this study, if nothing more, says
women are not worse.
They're not worse. They should be getting paid.
So they should be getting paid.
At least equal.
Absolutely.
Maybe more.
Maybe more.